Hi, I'm Hannah. I'll be conducting your intake interview today.
Hi, Ivan. Nice to meet you.
How are you today? How are you feeling?
I'm doing well.
And how has your week been?
My week's been fine. Nothing special, just work and a couple leisure things. Nothing special.
Okay. And what brings you here today to Alternative Strategies?
Well, as of recently, my wife and I have had a couple altercations, and I'm afraid it's become a pattern, and I just wanted to talk more about it, as I'm usually not able to communicate with her. So, yeah.
Okay, and before we get any further, I just want to let you know that everything's confidential. If you have any concerns or questions, feel free to stop me, and we'll take it from there. So, how long have you been with your wife?
It's gonna be 2 years this February, I think.
2 years?
Yeah.
Okay. And in the past 2 years, how much abuse has been going on, or situations?
Well, I'd probably say verbal almost every day, and then physical. Usually depends when she drinks, and like I'd probably say like twice a week or so.
Okay. The drinking, is it every day?
As of lately, yeah, but usually I know it would happen like usually when she would get physical, which would be about twice a week. So.
Okay, and has she always been a drinker, or is this just recently?
She wasn't initially a drinker. Of course, she would go out to a couple bars with friends and have a couple of drinks. But as a recent, she lost her job, and that's part of the reason she's been down. And the depression, I think, is what's leading her to chase the bottle.
Okay, I see. And is she working now?
No, she's currently not working, and I'm not really sure when she will be working because as her habits don't let her go out and find a job. She's just been around the house. And,
okay, I see.
Yeah.
And do you guys have children together?
Yeah, we have a 1-year-old actually.
A 1-year-old, okay. And would you say that she's somewhat abusive towards the child, or is it just mainly towards you?
Surprisingly, no, it has not gotten to that. If that were the case, I would no longer be with her. I think this is something that hopefully could be worked out. So I guess we'll see what will happen.
Okay, and what do you hope to get out of coming to see us today?
Well, I just hope to get a peace of mind, and I guess to collect my thoughts and to talk to you, maybe get a little advice on what I could be doing, because when we're in the situation, it's just very hard to actually like speak to her and tell her what I mean. A couple hours later, I may know exactly what I was supposed to say, but at the moment, I just can't find the words. So I'm hoping to be working with that.
Okay, great. And do you have any friends or family that know what's going on?
I have refrained from telling people, just because I have hope in the situation, and I don't want to get to the point where if things become better, which I'm sure they will, that just my family and her family has a different view on her just because of that.
Right. And have you confronted her with your issues? Has she offered to seek help, or does she know what's going on? Is a problem?
I think she's still, I wouldn't necessarily call it denial, but she's definitely extremely aggressive once I bring up the topic. So whenever I just bring it up, she just refuses to talk about it and just starts yelling. And so it hasn't gotten to the point where we're able to discuss the problem yet. So hopefully we'll get her in here and also get her with a counselor eventually and move forward.
Okay. And how bad is the physical abuse, would you say?
The physical abuse, it can range depending on how much she's been drinking, but anywhere from a slap in the face to just like a simple shove. It honestly just depends on her given day and on how her day was.
Okay. And have you reached the point where you feel like you could potentially get help, or are you trying to move away from the relationship completely?
As at this point, I'm still not giving up. We're recently married and we have a kid together. It's only 1-year-old, so at this point, I'm thinking we could work things out. So I have not given up, as you know, but I'm hoping we can get her some help.
Okay. And do you know if in the past she has been in any abusive relationships, or maybe growing up she's experienced abuse within her household?
Can't really recall right now. I know in her immediate family, most likely not. But then again, I mean, I don't know if perhaps like when she was younger, her and her siblings would get into fights. But I mean, not necessarily.
Nothing that stands out.
No, nothing.
Okay. because sometimes people, when they're abusive with their significant other, it's because it stems from their childhood. So, but I'm sure you would know of that.
Yeah, I don't know. I mean, maybe it's something that she failed to mention. You know, as you probably see sometimes, people try to suppress that and not tell people if they've been, you know, hit or assaulted in any kind of way when she was younger. I don't really know.
Okay, and would you say that she's a decent mother even with the drinking? Is she?
Yeah, I mean, when she's not drinking, she's a great mother. And when she is drinking, of course, you can't expect her to take the best care of the child. But she has not become abusive towards the child, so I guess I'm thankful for that as much as I can be.
Okay. So I think in the next few weeks we should move forward to try to resolve these situations. And I think the next step we should take is maybe bringing her in and having a group session.
Okay, yeah.
Do you think that she would be willing to do that?
I don't know. I think for the first couple of weeks, I think it's just gonna have to be me and you, and then I guess me find the words to bring this up to her because you know she gets pretty aggressive once I bring up any of her issues, and so I guess I'm gonna have to first work on myself to find the right words and hopefully get her here in a couple of weeks. But I think we can do it. I just think that we should start with the one-on-one sessions first.
Okay, that sounds good. And is there anything else you need to tell me about what's going on?
No, not really. Honestly, I'm just. I hope we can continue this, and I guess get deeper into like what's really causing the issue, and I don't know. I myself can't see it, so an outside perspective on the details of the situation, I think could be helpful.
Okay. Well, I think you're taking the right step in trying to seek help and seeing your other options and resources. So what we're going to do is we'll schedule an appointment for you to come back in a week from today, maybe.
Okay.
And we can talk more about the steps to take in order to help your situation out and get your wife help and come in here and talk to us as a group.
Okay, perfect.
Okay.
You've been very helpful today.